how to find exact cause in this case is your question. So in this case, what we saw, she said she has cold coryza, chilliness, throat pain since 4 days. She said, I went to a party, I had cake, pastry, and after that, my coryza increased. So we can say the cause is cake, pastry, and immediately we can jump to the pulsatilla. But later what she said, no, but before that, on Saturday night, I took hormonal pills to postpone my menses because Ganesh Chaturthi is coming, right? So before Sunday, she took hormonal pills, and now what she's saying, maybe it could be the reaction of that medicine. So now we have to see whether this all complaint started on Sunday after cake pastry, or it started before only on Saturday when she took medicine. So patient will talk like this only. Patient is going to throw information on you. He is not going to tell you stepwise or chronologically what first happened, what second happened. Patient is going to talk to you randomly. The information comes to the mind of patient, patient will give you. Now it's our duty to find out the exact chronology of the case. So what we did in this case, we asked her, tell us, you said on Sunday you had cake and pastries. So whether this coryza started before that or after that. So she said, no, before that it started, but I thought maybe cake and pastry, it got increased. So what we see, cause is not cake and pastry. Maybe it aggravated it, but it is not the cause. So go to the previous day, on Saturday. She said, I took hormonal pills to postpone my menses. So in this also we have to ask whether your problem started before taking pills or after. You understand? Now what we are doing in this case, we are trying to understand the ODP and the origin, onset, how it started, and for that matter we have to ask the chronology. Go to the past, ask from before the problem started, what has happened. So what we asked that female, okay, tell me, so your complaint started before taking that hormonal pill or after? So she said, no, maybe in the evening only I started feeling chilly, little bit uneasy, and night I took the medicine. So now you understand, when we go in detail of every aspect, we could see it started before that only, before taking pill also. So we asked her, tell us what has happened on Friday, Thursday, Friday, Saturday. We are going to go a little bit back and try to understand. So she said, no, Friday, Thursday, I was at home, nothing unusual happened. But on Saturday evening, I went out, right, on two-wheeler. And there was a rainy weather, right? The cold weather, cold air was there. And I went on two-wheeler, I came back home on two-wheeler, and I get exposed to the cold air, the rainy cold air. And after coming home, I started feeling little bit easy and chilliness started. Now this is what we are trying to do. We are trying to understand the chronology to find out exact cause. And now we could understand, she get exposed to cold air, rainy cold weather, cold air, wet weather, and she started chilliness. So what she said, after that I came home, after some time I started feeling chilly, and chill I felt, coldness I felt first in lower extremities, right? So chill began from lower extremities, and then my arms, hand, upper extremities started feeling cold, and I was chilly. I took the covering, still that coldness was not going, and then she started sneezing. So you could see in this case the exact cause is exposure to cold air, rainy cold air, wet weather, not hormonal pill, not cake and pastries. And then she said, I developed lot of backache, lot of joint pain, lot of headache, and headache was getting ameliorated by movement, to and fro movement. So what we see in this case, exposure to elements from exposure to cold air, cold, rainy, damp air, wet weather, and then chilliness beginning from lower extremities, pain, amelioration by motion. So now when you see this, the remedy comes Rustox. If you see in the chill beginning from lower extremities, Rustox is one of the remedy. So when we started the case, she said it started because of cake and pastry. We were thinking of pulsatilla maybe. Then she said maybe hormonal pill, allopathic medicine. We were thinking of Nux vomica. But when we went into the details and we took the chronology, ODP, and we understood cause is something different, and we could prescribe Rustox. So in any case, if you want, be it a chronic, acute, if you want to understand exact cause, go to the chronology, ask in detail what happened, how, any unusual thing you remember, any exposure, any fever, anything, any stress, any tension, any emotional, mental thing. Try to understand, get into the chronology in detail, and you will get the exact cause. Understood?